My name is Kinga Olortegui, and I'm one of the colorectal surgeons here at the University of Chicago. Within colorectal surgery, I treat diseases like inflammatory bowel disease, such as Crohn's or ulcerative colitis, colon and rectal cancer, anal cancer, and then very common anorectal problems like hemorrhoids and fissures. When I was growing up, my dad was sick with diabetes, and that was the original reason for me to be interested in medicine. I wanted to help people like him and families like ours. And then during medical school, I discovered that I was actually very good at working with my hands and in the operating room, and so had a little bit of a change from what I expected and found myself really loving surgery. This place is my home. I've been here since college, stayed for medical school, and then just couldn't ever leave. And I didn't want to because all of my incredible teachers were here. I trained to be a colorectal surgeon here by my mentors and now my partners. And so this place raised me and very much is a part of who I am now. I try to find what the patient needs specifically from me. And so I ask every patient what they do, what their hobbies are, so that I can help them to come to a decision that feels right for them. Because when they come to see a surgeon, no one wants to have surgery. And it's a very scary and foreign experience for most people. And so if we're deciding whether or not we should go ahead, I help them to put it into context of what they normally do and what it's going to mean for their everyday life. Something I do in every surgery is that if I was operating on John Smith, let's say, whenever I come into the operating room, I make sure during our usual timeout where we pause and everyone makes sure that we're on the same page, me, the anesthesia team, all the staff in the operating room. One of the things I always say as a mantra is that we're here to help John. And so I make sure that whatever things we were stressed out about outside the operating room don't come in to the operating room. We're there to help that person, and we focus on that until the job is done.